Hi, my name's Jennifer Winnington. I did my pamphlet on diabetes and you. I feel like it's important that we take the time to discuss with our patients normal lab results, the causes of what's going on, the treatments, what they can do on their side. I feel like on my side of it, coming to the ER, patients are not given what they need. I think it's because the ER's fast-paced environment. You got to get them in, you got to get them out. A lot of these patients don't need to be admitted. We control their sugars in the ER, and then they go home, and they're not managing themselves well at home. I think a lot of patients that do get admitted get to see a diabetic educator in some hospitals. They get the education they need, but for the most part on my end, as far as the emergency room and the urgent care, they're not getting what they need. 6.5 cases of diabetes per 1,000 adults, according to the Healthy People 2030 website. I guess when you say it like that, it doesn't seem like a lot, but to me it does. Almost 7 people per 1,000 people have diabetes, and just think about how many people in America there are. I don't feel like that's good. I think people, as they are going on with their lives, they want to go to fast food. They want to get something that's quick and easy, and healthy food is expensive. So I think it's just going to continue to rise. There are 2 causes of diabetes. The first one is a type 1 diabetic. That's deficient in insulin production. With type 1, there's no prevention really that they can do. There's no treatment as far as on their side to prevent it, and then there's no really known cause of it. It just stops producing. Then you have type 2 diabetics. That is usually an effective use of the insulin. So that's the people that have excess body weight and physical inactivity. So the people that aren't eating healthy, that aren't exercising, that aren't staying active, they're eating this unhealthy food, and then their body's like, oh, I get all this, I don't need to process it, so we can just store it, and it just freaks out. Some signs and symptoms is increased urination, excessive thirst, increased hunger, fatigue. There's fluctuation in weight. With type 2, you're going to have that increase in weight. Type 1, you might have the decrease in weight, and then changes in vision. When left untreated, adults with diabetes are at an increased risk of heart attack and stroke. It can reduce the blood flow to your extremities, which can cause neuropathy, and in those lower extremities, that can lead to an infection and amputation. I don't know how many patients have come in, they don't feel their feet anymore, so they're walking around the house without shoes, they're walking outside without shoes, they get one little cut, and then next thing you know, it gets infected. Well, they don't know it's infected because they don't feel it. How many times do you look at your feet? A lot of people don't. So they finally get to the doctor, and they're doing their assessment, and oh my goodness, your foot is necrotic. It's got to come off. Or the patients that are diabetic that clip their own toenails. A lot of diabetics don't know that you don't need to clip your own toenails. You need to go to a podiatrist that can do that for you. So a professional that knows what they're doing, what not to do. Don't clip too short. Don't cause a wound that's going to get infected that you're not going to feel, that's going to cause later problems down the road. Diabetes is also one of the leading causes of kidney failure. I don't know how many patients that come into the ER that are sugars are 800, 900, and I try to educate them. If you continue to let your sugar and your glucose skyrocket and not control it well and don't keep it down, your kidneys are going to shut down. And then once that happens, you're going to be on dialysis for the rest of your life, most likely. A lot of patients don't realize that, oh, my sugar's up, I'll just take insulin and I'll just battle it back and forth all day with insulin. You need to start with the exercise and the diet for the type 2s. You need to redo some education. You need to redo some healthy living habits. Because if you don't, you'll end up on dialysis because the kidneys just can't function. They can't handle it. Some of the treatments that I've already talked about, diet, physical activity, avoid tobacco, lifestyle modifications, that goes along with diet and physical activity, but it also goes along with educating and making sure your patient knows that, yes, while a diet soda, it says no sugar, there's still aspartame in it that has sugar. Or, your diabetic patient that says, oh, I'm just going to have one little treat. It's still sugar, and it's still going to affect your body in a negative way. There are medication therapies out there. I would consult your primary care physician or primary provider just to find the best regimen for you. There's metformin, there's glucophage, there's Ribelsis that helps lower your A1C over time. There's so many out there. There's insulin dependent diabetics, there's non-insulin dependent diabetics, there's people that have to take Levemir and Novolog and Novolent. There's so many range of insulins and treatment for diabetes. It's really best to talk to your doctor about that. I then went on to put at the bottom just some lab results, just so you know what kind of is normal for you, or what's supposed to be normal, so you know where you're falling on that scale. Fasting blood glucose levels for normal should be below 100. So that's when you fast after midnight, you go into the office first thing in the morning and you're checking your sugar, or they're drawing your blood, and it should be below 100. If you're pre-diabetic, that fasting blood sugar is between 100 and 125. That means that while you're not a full-blown diabetic yet, your body is like, oh, whoa, something's going on. We need to make some lifestyle changes, or this is going to get to the point where you're going to be diabetic. And then diabetes is 126 or higher on 2 separate occasions. So, you know, some stuff happens. You might forget, oh, I took something to drink when I took my medicine this morning, because you said I could take my medicine. I didn't know I couldn't have a drink with it. That's why they do 2 separate occasions, so you know that this is not just an isolated insulin. This is actually, you know, several times happening, so they do 2 separate. A glycated hemoglobin test, or an A1C, that's measuring your blood sugar for the last 3 months. A normal is below 5.7. Pre-diabetes is 5.7 to 6.4, and then your diabetics are above 6.5 on 2 separate tests again. You want to make sure that you're just not doing that one and, oh goodness, they had a bad couple months. You know, you want 2 separate tests. The random glucose should be anything below 200. If you're above 200 on any random glucose, no matter when you ate, when you drank last, I had Chick-fil-A at 2 o'clock. I checked my sugar and it's 202. That is diabetes. They're saying that once you're above 200, you're either at risk for diabetes or you're diabetic. You need to see a physician. They do an oral glucose tolerance where you go in, you drink some stuff, and they're going to test your sugar after that. A normal non-diabetic person should be below 140, that they've had the sugar, their body's processed it, the pancreas is like, oh, this is Instagram, and their body's doing what it's supposed to do. Pre-diabetes is 140 to 199. That means that your body's like, oh, I know what this is, I know what I'm supposed to do, but I'm just not functioning right, and I'm going towards being a diabetic. And then after 2 hours, anything over 200 is a diabetes. Just know that that's something that, you know, your doctor's going to talk to you about. Hopefully you get the education that you need. I took a lot of time to research this. I feel like we need to do better for our patients. How many patients we have that are on dialysis or diabetics that we don't really sit and discuss with, like, hey, let's talk about this. I had a patient the other day that was drinking, you know, diet soda, and they're like, oh, this is fine, it's diet, it says no sugar on it. And I'm like, ma'am, that's not okay. It still has artificial sugars in it, and just because it says no sugar, they're sliding it in there without you knowing, and it's damaging you. I think I really enjoyed making this pamphlet. I didn't realize how much I did. Just all the interesting facts that I found out, and stuff that I knew that I didn't know. I hope you liked it. I hope you enjoy it. Thanks for listening, and bye.